Good afternoon, everyone. My name is Camilo Avella. I'm a research assistant at Teaching Hospital Fundación Santa Fe in Bogota, Colombia. And today I'm going to talk about my study as a retrospective study on the impact on infectious outcomes using the homemade versus the commercial gallbladder during lab chole. None of the authors of this paper have any conflict of interest or any financial ties disclosed. So, as we know, the lab chole is one of the most common procedures done around the world, and is one of the most performed as an emergency procedure. And it has overcome the open technique since the late 80s, early 90s, for its greater benefits like reduced length of stay or better pain control overall. But still, the surgical site infection and intra-abdominal abscess remains as causes for postoperative morbidity. So with this study, our aim was to determine whether the gallbladder retrieval device could affect the infectious outcomes after the lab chole. We gathered clinical records from around 1,000 patients in a period of 2 years and 4 months. And later, we used the STATA software to analyze for ANOVA in nominal variables and chi-square for categorical variables. So we found a total of 1,092 patients, which we then divided into 3 groups. 195 patients did not use the bag for retrieval of the gallbladder. 68 were used homemade device, and 829 were taken out with a commercial gallbladder retrieval bag. Around 60% of our patients were female, 648 in total. And we found that it was not an evenly distributed sample. And for example, on our homemade group, there was an older population and also the distribution by sex. It was more female patients in this homemade group and with the no bag use group. ASA scores were on median on both 3 groups, or ASA score 2, but were not that evenly distributed among the groups. And a Tokyo scale grading score was higher on those who were the homemade bag. As for intraoperative findings, we found that there were longer surgical times when using this homemade device, about 44% increase in this case. Partlock score for the surgical findings were not that different among all those 3 groups. And there was no difference in the use of a drain after all. We found that it was a longer stay after the use of homemade device, and our surgeons did not use post-op antibiotics while using commercial or no use of bag at all. When using this homemade device, usually they prescribe post-op antibiotics at least for 24 hours, and we found no surgical site infection rate statistically significant among these 3 groups, just an overall rate of 0.18% in the whole hospital. So we found that although our sample is really not that evenly distributed, the use of a homemade device does not increase the chance of a surgical site infection. It's a feasible and low-cost tool for the everyday use, and depends on whether the surgeon practice. It takes a little bit more time to prepare in the OR, and therefore, these longer surgical times mean longer of a stay post-op. So it depends to the surgeon whether or not to use these homemade devices, but there's no critical advice against it when talking about surgical site infection. Thank you.